Hello, my name is Isela Carreño, and I just want to say, first of all, I really appreciate getting a chance to redo this part of my final. I'm not sure what I was thinking when I was reading the instructions, but I got it. I thank you for clarifying that for me. So anyhow. I did my final on Frank Gallagher. He's on the show Shameless. And I thought about him first because he's a character that I kind of, I would say that I gravitated the most during my early recovery, not just from drugs and alcohol, but having been grown in a, or having being grown up in a alcoholic household, and how just you know, the little things, the little quirks that come along with having to, but mostly my observation was on Frank's inability to kind of connect his ideas, or connect his drug use and drinking with the problems in his life. And I too was that way. And I think that's just kind of where people reach that pre-contemplation stage of recovery, where they know that there's a problem, but they're not sure, they can't connect the dots. And that's how I felt about Frank Gallagher. And I would say he's very criminologically oriented, and his thinking, is always on the come up. What can I do to make some money, regardless of the moral principles that you're breaking. And I think you see that a lot in our community, I guess, our substance use or SUD community, where they have a lot of other issues, not just the substance use itself, and just kind of like the complexity that creates within a family, is something that, unless you've gone through it, do you understand. And so I just kind of want to address his alcoholism and his dependence. And his behavior often reflects manipulative tendencies. He habitually prioritizes his own desires, frequency at the expense of his family's well-being. This pattern suggests a disregard for his parental responsibilities and underscores the profound impact of his addiction on his interpersonal relationships. And I want to say that was my first indicator, for me, was just to kind of realize that I had a whole bunch of problems with a whole lot of people, and sometimes you need somebody to kind of show you the way, that maybe if you didn't do this and this, this and this wouldn't be happening. But somebody in Frank's state of mind, he does not see that connection. And I would say he's in the pre-contemplation stage, and then at times he might get to the contemplation stage where he does realize that there's something in him that just knows, the truth. And I think most people pre-treatment are like this. It's kind of flip-flop kind of thing. And my opinion would be that Frank's ASAM level is 3.7, also referred to as the medically monitored patient. Inpatient management, representing a high structured intensive treatment while settling for individuals with substance use disorders or co-occurring mental health conditions. He's got a lot of mental health conditions, and I would say a lot of it is not necessarily objective. It is subjective and based on somebody else's observation, because he's so in denial that he cannot see that he's causing all these problems. He's also had a liver transplant as it is, and requires a lot of medical care, in addition to his opiate and alcoholic dependency, and his mental health condition, which is often, it's up and downs, and a lot of his family tends to say, would say that he is a very combative person in general. Frank is a middle-aged man and has been addicted to an array of drugs, including opiates and alcohol. My concern is that he'll need detoxification, which is why I place him in the 3.7 ASAM. And addition to his liver disease, as I explained earlier. Frank doesn't fit in with a single stage of change, like I said. His actions are consistently inconsistent, reflecting aspects of several stages simultaneously, including, instead of processing linearly, he goes back and forth, like I said earlier. And this is persistent, which is a persistent switch up where he reaches a pre-contemplation stage after doing something horrible to his family, but it's often short-lived. And currently, I would say, hypothetically, he's in the position where he used his family's rent money to go off for a weekend and party, as he states. I would say the DSM-5 diagnosis. Say patient states he really messed up and did something horrible while under the influence of opiates, but he doesn't understand why he did what he did. His strengths would be that he loves his children and will go to any lengths for them, as he's explained he's done some crazy stuff to get the rent back, and so he plays this game, doing wrong, doing good, doing wrong, going to pre-contemplation stage, saying maybe it is a problem, going back, saying it's not related to his substance use. And his weaknesses, he exhibits depression, and his children exhibit many forms of mental health concerns as well, including substance use within the home, within the children. So the goal is for the patient to wean off medication and slowly attach psychiatric stabilization and achieve sobriety. So an example for an intervention, a patient was given a cognitive behavior therapy for referral to identify his dependency on alcohol and opiates, allowing him to connect his drug use to the problems he caused in his family, to be referred to Al-Anon for his issues, and his children who are using cannabis and alcohol. Patient will address his history of domestic violence as a child and identify life changes, including dependence on withdrawal symptoms. Yes. Types of counseling. Patient will continue counseling individually and refer to a psychiatrist for a psychiatric evaluation, which I think is very important in his case given his mental health symptoms. Let's see. Okay. All right, so 5.1, his acute intoxication, withdrawal potential. Patient states he drinks 32-ounce bottle of vodka a day along with 20 plus Norcos a day. Patient states he really doesn't know. Some of the biomedical conditions and complications are that Frank has had a liver transplant before, and he epitomizes the dysfunctional patriarch, often drunk or highly frequently discovered unconscious by the family, or alternatively wasting scarce family resources on local bars. He generally appears relaxed and easygoing, but there are distinct instances when his demeanor shifts dramatically. In these moments, his frustration or even anger becomes quite evident, far beyond mild annoyances. This is just a fleeting mood. His reactions can create significant discomfort, intimidation among those around him. A particular notable loss of composure can be escalated to a concerning level. Again, his readiness to change. Frank is currently in the pre-contemplation stage. He describes having spent the money and feelings of worthlessness. And for this moment, he can feel the connection between the two. Frank has tried many times in the past to achieve sobriety on his own, only to fall back on addiction shortly after. This would be his first time in residential treatment. His continual problem potential is optimal if he separates himself from his codependent children. Residential, I suggest the minimum of 3 months in residential treatment and continued residential housing after the fact, since he is an older guy and he probably needs a little more time to actually get a little bit of that change going. And I also referred him to Al-Anon and AA for his dependencies. An example of a GERP note. For me, I would say the goal, the patient will reduce alcohol consumption, and the intervention, patient met with counselor to conduct CBT therapy. His response, patient stated that he was overwhelmed with so many groups and he is not sure he will be able to handle the load. My plan is for the patient to continue meeting with a counselor at minimum of 1 time a week and attend 5 AA panels a week, participate in peer-run groups 5 times a week, CBT therapy 1 time a week, and a referral to a therapist 1 time a week. A SMART goal for Frank Gallagher would be within 1 month, Frank will successfully complete therapy session focused in identifying and maintaining his impulsive behaviors, leading to 50% reduction in instances of his impulsive behavior as measured by a therapist. The community resources, like I said, I would refer him to definitely Alcoholics Anonymous and NA and Al-Anon to deal with his childhood traumas. And I believe that's it. I did turn in an outline for what I'm saying. So thank you again, once again, for the opportunity to review this. Thank you.